Today we're going to talk about HIV transmission, a topic that's often misunderstood but incredibly important for everyone to know about. HIV, or human immunodeficiency virus, is spread through specific body fluids, and understanding how transmission occurs can help protect you and your loved ones. HIV is transmitted when infected body fluids from someone who has the virus enter another person's body through specific entry points. Let me break down the three main ways this happens so you have accurate, factual information. First, unprotected sex. Vaginal or anal sex without a condom or without being on HIV prevention medicine like PrEP carries the highest risk of transmission. The virus can enter the body through the linings of the vagina, anus, and sometimes the penis. Oral sex has a lower risk, but transmission is still possible if there are cuts or sores in the mouth. Second, sharing needles or syringes. Sharing needles, syringes, or other injection equipment with someone who has HIV creates direct blood-to-blood contact. This includes injecting drugs, steroids, or even getting tattoos or piercings with unsterile equipment. Third, mother-to-child transmission. A woman with HIV can pass it to her baby during pregnancy, childbirth, or through breastfeeding. However, with proper medical treatment, this risk can be greatly reduced to less than 2%. Now let's clear up some common misconceptions. HIV is not spread by hugging, kissing, or casual touching. It's not spread by sharing food or drinks. Mosquito bites cannot transmit HIV, and you cannot get HIV from using the same toilet or shower as someone who has the virus. Knowledge is power when it comes to HIV prevention. Using condoms, getting tested regularly, and considering PrEP if you're at higher risk are all effective prevention strategies. Regular testing is important because early detection leads to better health outcomes and prevents transmission to others. Remember, people living with HIV who are on effective treatment and have an undetectable viral load cannot transmit the virus sexually. If you have questions about HIV, talk to your healthcare provider, stay informed, stay protected, and help reduce stigma by sharing accurate information. Thanks for watching, and remember, accurate information saves lives. AIDS. It's a word that's carried a lot of fear, stigma, and misinformation over the years. But what is AIDS really? And what should you know about it today? Let's break it down together. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV infection, HIV being the human immunodeficiency virus. When untreated, HIV slowly destroys the immune system, leaving the body unable to fight off infections or certain cancers. That's when we call it AIDS. So, what are the symptoms of AIDS? You might be surprised to know that they're not always obvious at first. AIDS usually develops after years of untreated HIV. Some common signs include chronic fatigue, just always feeling tired, rapid weight loss, frequent fevers or night sweats, and swollen lymph nodes that don't go away. Other symptoms can be persistent diarrhea, white spots or strange lesions in the mouth or on the tongue, skin rashes or bumps, shortness of breath, or a cough that just won't quit. People might get frequent infections like tuberculosis or pneumonia, and even experience memory loss, confusion, or depression. These symptoms happen because the immune system can no longer protect the body from opportunistic infections or certain cancers. But how is AIDS diagnosed? There are two main ways. First, if someone with HIV has a CD4 T-cell count below 200 cells per cubic millimeter, normal levels are 500 to 1600, that's a clear sign. Second, if they develop one or more AIDS-defining illnesses, these include diseases like tuberculosis, a type of pneumonia called PCP, Kaposi's sarcoma, invasive cervical cancer, and some serious fungal or parasitic infections. Doctors use a few different tests: HIV antibody or antigen tests, CD4 cell counts, and viral load tests, which measure how much HIV is in the blood. Now let's talk prevention. The best way to prevent AIDS is to avoid HIV infection in the first place, or to manage HIV effectively if you have it. So how do you prevent HIV transmission? Use condoms during sex and don't share needles or syringes. Get tested regularly and know your partner's HIV status. For people at high risk, there's a medication called pre-exposure prophylaxis or PrEP that can help keep HIV at bay. If you think you might have been exposed to HIV, there's also post-exposure prophylaxis or PEP, which you need to take within 72 hours. Healthcare workers follow strict safety guidelines too, like wearing gloves and disposing of needles safely. And for HIV-positive mothers, proper treatment can prevent passing the virus to their babies during pregnancy, childbirth, or breastfeeding. If you already have HIV, the key to preventing progression to AIDS is early diagnosis and sticking to your medication. This is called antiretroviral therapy, or ART. Now here's some good news. While there's no cure, HIV and AIDS can be managed as chronic conditions. ART is a combination of drugs you take for life. It suppresses the virus, helps the immune system recover, and can even reduce viral levels so low that they're undetectable, meaning you can't transmit HIV to others. That's the U equals U message, undetectable equals untransmittable. Opportunistic infections are treated with antibiotics, antifungals, or antivirals, and cancer may require its own treatment. Supportive care matters too. Good nutrition, mental health support, and a strong community can make all the difference. Let's sum it up. AIDS symptoms include things like fatigue, weight loss, infections, and skin problems. Diagnosis is based on a low CD4 count or certain illnesses. Prevention: practice safe sex, don't share needles, consider PrEP or PEP, and stick to ART if you're diagnosed. Treatment centers on lifelong ART and managing infections or complications. AIDS doesn't have to be a death sentence. With the right information, prevention, and treatment, people with HIV can live long, healthy lives. If you want more resources or a printable guide, just let me know down in the comments. And remember, knowledge is power. Take care of yourself and each other. Today, we're going to explore one of the most important health topics of our time: AIDS, or acquired immunodeficiency syndrome, and its relationship with HIV. AIDS is the most advanced stage of HIV infection. HIV attacks the body's immune system. Specifically, it targets CD4 cells, also known as T cells, which help fight off infections. When HIV severely damages the immune system, the person develops AIDS. Early HIV infection often appears as flu-like symptoms 2 to 4 weeks after infection. These include fever, sore throat, fatigue, rash, swollen lymph nodes, headache, and muscle aches. As HIV progresses to AIDS, symptoms become more severe and persistent. These include rapid weight loss, recurring fever, extreme fatigue, and opportunistic infections. HIV is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. The main modes include unprotected sex, sharing needles, mother-to-child transmission, and blood transfusions. Once inside the body, HIV targets CD4 cells, uses them to replicate itself, then destroys these cells, weakening the immune system progressively. HIV diagnosis involves several types of tests, starting with antibody and antigen tests. These detect antibodies or P24 antigen in blood, with results in minutes to days. CD4 cell counts help determine disease progression. Normal levels are 500 to 1600 cells per cubic millimeter. Prevention includes behavioral strategies like using condoms correctly every time during sex. Limiting sexual partners, getting tested regularly, and avoiding needle sharing are crucial. Medical prevention includes PrEP, a daily pill that reduces infection risk by up to 99%. PEP provides emergency protection within 72 hours of exposure, and treatment as prevention means undetectable equals untransmittable. Antiretroviral therapy, or RT, is a lifelong treatment using combination drugs. ART suppresses the virus to undetectable levels, allowing people with HIV to live long, healthy lives. While there's no cure yet, research continues for vaccines and potential cures. Some functional remission cases give hope, though they remain very rare. Remember, early symptoms can be flu-like, diagnosis involves multiple tests, transmission occurs through specific body fluids, prevention is highly effective with proper precautions, and treatment allows people with HIV to live normal lifespans. If you have concerns, consult healthcare professionals and get tested. Knowledge and early action save lives. Stay informed, stay protected, and support those affected by HIV and AIDS.